Hello, my name is Dr. Lyly Nguyen, and I want to thank the Aesthetic Surgery Journal for choosing our journal article entitled Preoperative Risk Factors and Complication Rates of Breast Augmentation with Fat Grafting for Editor's Choice. I want to thank my co-authors, Drs. Afshari, Dr. Perdikis, Dr. Higdon, and a very special thank you to Dr. James Grotting for access to the Cosmetasure database and guidance on a very important topic. In this study, we utilized the Cosmetasure database, which is a large multi-center database to determine the major complications and risk factors of patients undergoing breast augmentation with breast fat grafting and in comparison to breast augmentation with implants. Major complications were defined as complication requiring either visit to the emergency department, hospital admission, or reoperation within 45 days postoperatively. We found that from 2017 to 2019, 789 patients underwent breast augmentation with fat grafting and 18,544 patients underwent breast augmentation with implants. Patients who underwent fat grafting were more likely to be older, obese, and have a higher ASA class. They were also more likely to be smokers. The complication rate in the fat grafting cohort was 3.2% compared to 2.3% in the breast augmentation with implant cohort, which was statistically significant. We further broke this down into types of complications and found that infection was significantly higher in the fat grafting group at 1.1% versus 0.5% in the implant group. In breast fat grafting, tobacco use was an independent risk factor for any complication as well as infection with a relative risk of 17.1 and 20.2 respectively. Fat grafting to the breast has increased in popularity and demand for a multitude of reasons. With our data, we can better counsel patients on the complication rates and identify patients who are at higher risk for developing complications. Given that we found a higher rate of infection in the fat grafting cohort compared to the implants cohort, albeit low, surgeons may want to consider postoperative antibiotic use after fat grafting to the breast, though this warrants further investigation. Based on our data, one can also make a good argument for tobacco use to be a contraindication to fat grafting to the breast. We hope that this data is helpful in educating our patients. Again, thank you to the ASJ for this opportunity to present our data.